Hi, this is Dr. Liia, and I'm here with my husband.
Hi, my name is Dr. Sumant Ramachandra. I'm a physician scientist. I'm a doctor of internal medicine and a doctor of immunology. Thank you for having me here today.
So today we are going to be talking about sleep.
Okay.
I'm already very sleepy now.
All right. I hope we're not putting you to sleep.
I hope not. But
with these
who
topics.
knows? It's good for you. So if you get a little bit of sleep while we talk, it may be good. So, how does poor sleep affect our metabolism, hormones, and ability to lose weight?
So, sleep is an incredibly important part of your daily routine. All cells need to clear junk. Sleep is a way for us to actually help also rest the brain, not just the body, but the brain. And the brain uses that period to start clearing toxins, proteins that are excess in there, and some of those proteins are actually toxic to your brain. And sleep is an incredibly important part of this. So people who do a lot of great fitness and wellness work, they're not getting enough sleep, they're fighting against this mechanism, and it has long-term consequences, negative consequences when one doesn't sleep enough. But we'll talk about it in a moment. Too much sleep is not good either. And where's that Goldilocks zone is really important to understand.
Let's talk about immune, like you are an immunologist. So is there a connection, real connection between sleep and immune function? And how much sleep is enough for the optimal health?
There is a lot of correlation between sleep and a lot of functions, frankly. Some of them rise to what we call level 1 evidence. Level 1 evidence is they look at people who have not slept much in a formal study versus people who have slept adequately versus people who have slept too much. And then they look at a lot of measures and markers and things like that. The problem with these type of studies, sleep is a kind of a lifestyle, and lifestyle studies are very, very difficult to conduct. You need very large number of people in every single arm. You have to compare it, you have to make sure it's statistically significant.
And what is large? What is?
I think in a sleep study, if you're looking specifically at things like weight and sleep, you probably need in the hundreds of patients. If you're looking at blood biomarkers where you can measure small changes, you probably need far less patients in that. So lack of sleep puts a lot of stress, not only on your brain, it puts a lot of stress on your body. And your immune system takes a direct hit because of those stress hormones get released during the process of not sleeping. And if you have multiple days of not sleeping, talk to someone who hasn't slept much. 2-3 days in, they are not easy to deal with. So sleep actually puts a lot of stress in your body, and that stress causes your immune system, lack of sleep I should say, puts a lot of stress in your body, and that lack of sleep causes your immune system to also get hit negatively.
Mm-hmm. So you can also develop some chronic conditions.
Absolutely.
Right? If you're chronically sleep deprived.
Yes, if you're chronically sleep deprived, it has a number of associated or correlated disease states.
Mm-hmm.